Health leaders here at home and across the country have sounded the alarm on that crisis for a long time, and the pandemic has exacerbated that problem.
So we spoke to one local physician about a problem that affects so many of our neighbors. Let's get to 41 Action News reporter Dan Cohen to explain this increase we're now seeing, Dan.
Yeah, the pandemic has really made this an even more significant problem, Taylor and Lindsay, and the CDC has tracked deaths from drug overdoses for years and now say that more than 70% of those overdose deaths are a result of opioid use. Recent trends are even more concerning for the healthcare community.
We've seen some similar trends to what's been happening nationally, which is about a 30% increase in opiate overdose deaths. In Missouri, there's been about a 30% increase in overdose deaths during the pandemic. And here locally in the KC Metro, it's been about 15% increase in overdose deaths. This is something that unfortunately some people turn to illicit street drug use when they're addicted to medications, and these synthetic drugs on the street are much more high risk for overdose.
Pandemic-related inactivity and staying at home has also contributed to a rise in chronic pain among patients, as well as limited access to key addiction services and medical care. There has been a key development in Missouri. Governor Mike Parsons signed SB 63 into law, paving the way for the state to set up a prescription drug monitoring program to provide a stopgap to abusing these controlled substances. Taylor and Lindsay.
Dan, anytime we talk about opioids, we need to make sure we educate our audience on what to look for in case they have someone in their family or a loved one or our friend that is dealing with it. What are some of the signs of addiction people should watch for? Because I'm assuming they could run a wide range.
Yeah, they do, from the subtle to the more obvious, and we'll put those on the screen for you now. Here are a few of those signs of someone addicted to opioids: an inability to control medication use or cravings, irritability, anger, or mood swings. He also pointed to lying about medication use or stealing other people's medication, as well as trouble in social situations, both personally and professionally. Dr. Foster says when usage starts to affect all other areas of life, that's when the need for treatment is urgent. And we'll be talking about St. Luke's alternative pain programs coming up on 41 Action News today at 6.
Dan, thank you.